welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are super excited to have Dr. Shawn Baker back on our podcast. It's been a little bit over 4 years since we've had him on our podcast, and we are super excited to have him on. He is on the carnivore diet himself. He eats mostly all carnivore and some dairy and eggs, I believe. I'll let him clear that up. And he's been doing that for 7.5 years. And according to most of the health experts, he should be dead by now, but he is alive and thriving. Not only is he a doctor that cares about people's health, but he's an athlete himself. He lifts a lot of weights. He's a rowing champion, and just a great guy that really cares about people's health. So, Dr. Baker, welcome back to our show.
Hey, well, thank you for that very nice, gracious introduction. I like the music, got me woke me up, so that was good.
Yeah, that song was actually custom made for our podcast. A good friend of mine, Lee Pence, who actually lives right near your area over in Anacortes.
Okay, nice, awesome. Well, it's good to be back.
Yeah, so tell us a little bit about your history of the carnivore diet. Originally, I think it starts out as you being an orthopedic surgeon recommend the keto diet, correct?
Yeah, that is correct. Yeah, I mean, I started out, a regular doctor, went to medical school, got trained like every other doctor does, worked hard, did real well in school, got into orthopedic surgery, spent, a couple decades practicing standard medicine. And somewhere in that time, I got a little older and started to see my health kind of getting, deteriorating a little bit like most older people do. And I really wasn't too excited about that. I didn't think that seems very good. And as you're right, I've been an athlete my whole life. And so I was still training very hard. And so I started playing with nutrition and went through various nutritional sort of strategies, and some better than others. And I ended up on a low carbohydrate approach, which for me was something for the first time gave me some sense of satiety where I didn't feel hungry all the time, which I thought was really kind of unique because I'm a pretty big guy and I like to eat a lot. And so that for the first time gave me sort of some control over appetite, I suppose. And then, as a surgeon, I was taking care of a lot of people that were overweight that needed joint replacements. And as a community of orthopedic surgeons, we said, if we keep operating on all these overweight people, we have more complications. Just they're at higher risk for blood clots, infections, poor rehab. There clearly is problems there. So as a community, we decided, hey, we're not gonna operate on anybody whose BMI is over 35, and you have to do what you can do to get them to lose weight. And so I was suggesting at that time ketogenic diets, which actually were, in the paper, people that would actually do them, they tended to work. But more importantly, which was really interesting to me was many of the patients would come back within a week or two. Really, I mean, I would send them out on a diet and have them come back in 2 weeks to see how they're doing. And even before they lost any weight, a lot of them were saying, my knee doesn't hurt anymore, which I thought was really very interesting. In fact, I just did a consult with a 73-year-old woman today who was saying she was told she needed a knee replacement. She went carnivore, and now she's hiking 3 hours, and has no pain. And so that was interesting to me. So I got really excited about and interested in the fact that we could potentially treat things like arthritis just with diets in many, many cases. And so that kind of led me down the rabbit hole of nutrition and lifestyle. And, that was back in 2015. So we're nearly 10 years later. I'm now full-time lifestyle. I've got a company, Rivero, licensed in all 50 states, where we basically take people with various illnesses, whether they're cardiometabolic disease or autoimmune or inflammatory things, and just, do appropriate lifestyle medicine with support, with coaching and technical support. And we're getting people off medicines, which, I make you guys a little happy. You guys are pharmacists. So my goal is to, as much as possible, deprescribe drugs and get people off these things, because I think in the long term, they're only just, kind of Band-Aids in my view.
Yeah, absolutely. And, you're talking to two pharmacists that don't believe in drugs to treat long-term disease. So, that's one of the reasons we're having you on. Speaking of drugs, I know Janet is a big proponent of statins. Laugh. So you have a question for Dr. Baker about cholesterol and his cholesterol personally.
So recently we saw a post, and I'll give you just a little background. Going through pharmacy school, I totally bought into, lowering your cholesterol as low as you could get it to prevent cardiovascular disease. And shortly after we graduated and we started practicing, we started realizing everybody was put on a statin. Everybody was showing up with the statin, and it was always the new statin that was going to be better and blah, blah, blah. But a lot of the clients didn't stay on them. They might tell their doctor they are, but they didn't refill them, or they stopped taking it because they had side effects. But what I'm seeing now is people coming into us and asking about their cholesterol levels and what do they feel about it. Well, when we watched your little video about yourself and your journey with traveling back from Canada and looking at fasting and then what kind of results you had, I just kind of wanted you to kind of summarize that a little bit and give us a little bit of what you feel about what's going on with the cardiovascular disease.
Yeah, well, I mean, it's interesting, like just to sort of put this in perspective, if you take if you take a newborn baby and you breastfeed them, arguably that's what's supposed to happen, right? I mean, breast milk is probably not killing people. A 1-year-old baby will attain a total cholesterol level of around 200 plus or minus about 20 or 30 points within about 13 weeks. So within 13 weeks of breastfeeding, that's 3 months basically. A baby has dangerously high cholesterol levels.
Right.
So it's kind of like, wait a minute, does that make sense? But
Right.
To the point about the little sort of quote unquote experiment I did myself, there's this sort of I guess theory called the lipid energy model that postulates that if you're in a very low carb state and your glycogen levels are not, your liver glycogen particularly is not full of glycogen, most people walk around with too much energy stored. They have stored body fat, stored glycogen, energy surplus. And so what happens in that situation is your liver doesn't need to traffic as much energy, particularly fat. And so when you are in a relatively energy depleted state, particularly in a low carb situation, then the liver is then needs to move energy into the bloodstream so the cells have nourishment, so they have energy. And so with me, so I did this sort of experiment. I said, I'm going to check my cholesterol. I've got a home cholesterol monitor, which are actually, when you look at the literature on that shows that they're, 90-95% accurate. So they're going to be maybe not exactly on the money, but they're going to be reasonably close. And I verified it with a couple of readings. But I had one where I hadn't eaten in about 24 hours, but I was sitting in the car all day. I was driving, didn't do much. I hadn't eaten yet. And my total cholesterol was 156. So it was clearly a fasting number. It wasn't a postprandial number, which means, my stomach was cleared out. And that's a 156 total cholesterol. Everybody's going to be happy with. Most of your doctors say, oh, that's great. It's below 190. Good job. So I checked it. So I continued to fast and I did a little workout. I did some rowing and cycling and stuff like that for about an hour. And I ended up fasting for like 37, 38 hours. And I checked it again and it went from 156 up to 346. So nearly a 200-point jump in under 18 hours, which is, it's interesting. But I mean, the question would be if I went to the doctor on the Monday and had my cholesterol drawn, they say, oh, good job. But if I went on the Tuesday, then the very next day they would say, oh my God, we need to put you on a statin for the rest of your life. Go see a cardiologist, open the cath lab. You're going to have a heart attack right now. So it just shows you how dynamic these labs can be. And we know, like, for instance, literature clearly shows that people that have been on fasts for any period of time, there's a study on there that shows, I think 7 days of fasting is associated with up to a 70% increase in your cholesterol level. So then you're saying, well, wait a minute. Does that mean not eating all the time is bad for me now? So I should be constantly eating, which we clearly know the results of that. Everybody's obese. So I think there's a lot more sort of nuance to this stuff. And I mean, I am not someone who says ignore cholesterol, but I will say that I think it probably turns out to be a dependent variable. That is to say, it's part of the pathophysiology, but it's not because some people say it's both necessary and sufficient. I would say it's probably necessary, but maybe not sufficient. So in my view, and we're, and as you guys are familiar with, there's this whole lean mass hyperresponder study going on where we're looking at what happens if you have really, really high cholesterol, but you're otherwise healthy. You don't have diabetes, your blood glucose is normal. You don't have hypertension. You're not obese. You don't have signs of metabolic disease. Right. What happens in that situation? Because we don't have a lot of data on that. There's very little. And so Matt Budoff at UCLA, Nick Norwich from Harvard, Dave Feldman, who's an engineer who came up with this theory, are testing that in a very formal way using high precision angiography, CT angiography, to look at that. And their preliminary data so far shows, which is quite interesting, it got quite a bit of, it raised a lot of eyebrows, was that people that had really, really high LDL cholesterol, we're talking 300, 400, 500, for at least 5 years, and were older, at least 55, maybe 65, 70, had basically zero plaque seen or very little plaque seen compared to, a similar matched group that had normal or low cholesterol. So there's a Western Danish heart registry study done by Mortensen in 2023 showing that people that had a 0 CAC score, what predicted whether or not they went on to develop cardiovascular disease, heart attacks, strokes, revascularizations, sudden death. LDL cholesterol had zero to do with that if their CAC score was 0. So to me, that means there's some dependency there. Now, if your CAC score was not 0, then LDL cholesterol was in fact, a contributing variable. But so in my view, it's not as cut and dried as people have you make it out to be. Most people will say it's just a matter of how many particles of cholesterol you have and how long you're exposed to that. That's what the prevailing, doctrine or dogma is. And I think we're finding I think we're going to find that that's not the case, and that there is, there are exceptions to that, and there are mitigating factors, and probably it's more common than we think it is, because there's a lot of people that have heart attacks with quote unquote low LDL cholesterol, and there's a lot of people with high cholesterol that never have heart attacks. So why is that?
Well, and here's one of the things I say as a pharmacist. Cardiovascular disease is at an all-time high in the United States. More people die of heart attacks and strokes than ever before, and yet statins have been out for over 30 years. So it's that alone, and a lot of people are on them. In fact, most people that have heart attacks are on statins already, and they repeat heart attacks. So my rational thought is what we're doing is not working. There's more to it than just cholesterol, or if the statins were working so well, cardiovascular disease would go down.
Well, I mean, I think the counter argument is it's just not low enough. We got to get it lower and lower. And so now they've got, the PCSK9 inhibitors where they're talking about, even genetically modifying us so that we don't express this PCSK9, receptor. And so now we've got people that their LDL, like there's people talking about, we want LDL cholesterol or total cholesterol to be the level of what a newborn infant has. And you remember, a newborn infant, his brain has not even finished developing.
Exactly.
And
oh my goodness.
So they're going to, I'll be a little crass here, but I liken it to saying that I want to avoid sexually transmitted diseases, so I'm going to cut off my genitals. I mean, that's to me the same sort of logic that's going on with that stuff. And there's some downside to that for sure.
Yeah. Well, and go ahead, Jen.
Well, I think we chase the lab, but we don't remember the consequences to some of this too. I mean, I feel like Alzheimer's and dementia is something we've kind of created in our medical field because we've taken that cholesterol away from the brain. And the idea that, we're going to improve health when we take cholesterol away from the structure of a cell is still kind of frightening to me. So what are we going to do to people? Are we going to put them in, chronic dementia, and then we're going to cause problems with their joints and all that? I mean, there's just a rationale of just chasing a number without any consequences or understanding where that's going to take somebody.
Yeah, very true. I mean, there was you guys may be familiar, there was a pilot study looking at people with dementia where they did a withdrawal and a rechallenge study where they had people that were demented, were expressing symptoms. They took them off the statin drugs and their cognition improved significantly. They put them back on the drug and immediately their cognition got worse. Yep. And so that's an interesting study there. And, I think, the people that are advocates for this super low LDL cholesterol point to something called A-beta lipoproteinemia, which is a genetic disorder where people just have very, very, very low cholesterol. And they'll say that, well, they don't die early and therefore there's no problem. But that population does have problems. And also to conflate a genetic disorder with an environment or drug-induced state, it's not the same thing.
Not even close.
Irrespective of that. And so, I mean, it's something that I think is a lot of people are going to be I mean, there's going to be a lot of money made, of course, but I mean, a lot of people are going to be injured in the process, most likely.
Well, I think it's worth repeating that over 50% of our cholesterol that's in our body is made up inside our body, not from diet. So that alone should be kind of telling that it can't be all bad.
Well, I think the number I've seen was 80% is made in our liver. So yeah, I mean, it's there for a reason, and it has a role in immune function. It has obviously with sex hormones and all kinds of things where cholesterol is the backbone of that. You guys remember the cholesterol to all the different synthetic pathways to make all the different hormones. So yeah, I mean, we see low cholesterol associated with increased rates of suicide, low cholesterol associated with greater rates of violence, dementia, things like it. In primates, if they have primates where they feed them in a way that they have very low cholesterol, they become very violent, which is kind of interesting. And we see the same thing in humans. So it may explain, you see when you go out, you see how angry people are these days. It seems like everybody's unstable, and it's like, man, maybe you need some more cholesterol floating around to chill you out a little bit.
Or they need a steak.
Yeah, or a steak. Yeah, that would help. Yeah.
So let's move on from cholesterol, and so I think we've talked about that enough, and the fact that when a doctor talks about eating red meat causing high cholesterol, well, that doesn't necessarily mean that it's going to cause cardiovascular disease. But tell us about some success stories of the carnivore diet that you've seen in patients. Let's talk about Lindy first. Limitless Lindy out of Australia. She was a patient that was 700 pounds, I believe.
She was actually up to 800 pounds at one point. Yeah,
and she was going to go and do bariatric surgery, and she decided against it. I think that's a good decision. And she went carnivore, and she's lost 600 pounds or something. Tell us the story.
Yeah, well, she was, I had a nice interview with her a couple months ago. Yeah, she's an Australian gal. About, like you said, she was close to over 800 pounds. It's hard to measure at that certain weight, but she was up around 800 pounds. She tried everything, vegan diets, juicing, Weight Watchers. I think she had a gastric band even at some point. All of that had failed her. She was a food addict. I mean, she could not stop, no matter what, she could not stop consuming, I think she was like chocolates and ice creams and sweets and things like that. And she ended up going carnivore, I think a little over 2 years ago. And during that period of time, she's lost nearly 500 pounds. And the real important, I mean, that's tremendous, obviously, of course. And just feels so much better. But I think the really interesting point was she said she was a food addict. And when she went carnivore, she finally found what she called was the off switch. Like she'd never been able to turn off the intrusive desires and cravings and thoughts around food. And finally, it went silent for her. So now she's able to negotiate the world and life and all the, the horrible food environment that we live in without succumbing to that. So, I mean, she's had a tremendous success. And she's joined, there's another guy, Todd from Montana, similar situation. He was 770 pounds. 600 pounds at age 14, by the way, which I thought was incredible. Montana kid, grew up in a fairly poor home. He was just addicted to basically soda. I mean, he would drink 20 cans of Coke a day or something like that. And he kept same thing. Went carnivore, finally was able to kick the Coca-Cola habit, and now he's down. I think he's lost over 300 or 400 pounds now. I just saw him this morning, in fact, doing great. I mean, so we've seen some tremendous. I think a lot of people either underestimate or completely ridicule the thought of food addiction, which I think clearly there are people that are. I mean, what is, if you look at what is an addiction, it's doing something that is harmful for you, and these people know it's bad. It's not like they don't know what they're eating is killing them, but they do it anyway. And so, I think it's particularly effective. If you look at any other addiction, whether it's alcohol or, any kind of drug, heroin, you would never recommend someone to say, hey, just shoot up on the weekends, it'll be fine. I mean, so I think for some of these people, the abstinence is such an important aspect of that. But so, we see that with morbid obesity, food addiction. It's been very effective. We've seen tremendous success around autoimmune diseases. There's in the United States right now, the estimates are between 22 and 50 million people now are suffering with an autoimmune disease, which is a hell of a lot of people. And those numbers are going up clearly over the last 30 or 40 years. Are just going up and up, like everything else you mentioned. Cardiovascular disease, cancer rates, all these. I mean, the survivability is higher. I mean, we've got less cardiac mortality because we can keep people alive with technology, but the incidence is just still there. It's still high. And despite the fact that we've been on this push for low fat, whatever grain diet, I mean, we've literally decreased our red meat consumption in this country by about 30 or 40% over the last, since the 1970s. So that certainly has not helped. But yeah, we've got like autoimmune inflammatory bowel disease, Crohn's disease, also colitis. We've had so much success with that. There is a case series coming out of Harvard probably next month that's going to show that. I mean, these people were biopsy proven. I mean, endoscopy, colonoscopy, biopsy proven Crohn's disease and ulcerative colitis, carnivore diet for various periods of time, 6 months, a year, 18 months. And now they are complete remission. They have no medications they're on. And as you guys know, those biological infusions are incredibly expensive. We're talking, $5,000 a month, sometimes more than that. It's incredible how expensive these drugs are getting. So,
and the side effects, some of them we don't know.
Well, you're suppressing the immune system, right? So it's like, well, you're more risk for infections and cancer for sure. And who knows what else.
You mean these people don't need drugs the rest of their life? They lack something besides a drug?
Yeah, it's not. It wasn't a drug deficiency. Yeah, it's kind of funny. Wait, you mean I'm lacking metformin, or I'm lacking, Crestor, or something? I've got some deficiency where I don't have enough drug in my system.
Well,
yeah, I mean, it's. I think the really problematic thing is we don't ask why anymore. Why am I sick? Well, and often the doctor will say, well, we don't really know, or it's bad luck or genetics or some sort of lame excuse. And if you don't know why, if you don't know why you're sick, then it's really frustrating. It's really what I call it's disempowering to you, because I don't know what I can do now. And if they say, well, you just need to take this drug the rest of your life, then now you're doubly disempowered, because now you're dependent. You're dependent on some other guy to prescribe you these medications, and you feel like you're completely hopeless. And so when you find out that, yes, there is a reason for you to have a disease, and two, you can do something about it, that becomes now very empowering. And I think that's the really, really fun part that I find, that I get people, you give them some sort of something they can do, and they can get after it.
Absolutely. One thing that really hit home, although I was thinking, I thought about it before, but one thing you said one time when somebody said, show me these studies about the carnivore diet and how it, reverses all these diseases and how it's safe and all this kind of stuff. And your comment back was, I don't know, 10,000 years of evolution. Can you comment on that?
Well, again, this is something funny, because I was in a debate with a vegan doctor, and we were talking. I said, I don't really know definitively if I'm going to live longer or shorter, if I'm going to get heart disease or not. I can't know that. There are no studies of any diet that have ever been done that conclusively prove that. And so I could suggest, we've got a long history, evolutionary history of the human species consuming a lot of meat, at times probably very highly carnivorous for our existence. There are obviously historical populations. We can look at health data on populations that do consume a lot of meat, and we can make inferences on that. But it's still not, it's not, I can't say 100% certainty, but what I can say, and I often say, look, I can take people who are sick and suffering today, and I can make them better. And as a physician, that is really my job is not to make someone live to be 100. I didn't go to medical school to say, first do no harm, first make everybody live to 100, because we have no way of knowing that. So it's like, let's get people healthy, and then stop worrying, because it's all speculative. I think, we think maybe based on this kind of confounded epidemiological stuff that may or may not be any good. I mean, I use the analogy of, like, if I were to board a plane and, I get there and the pilot's drunk and one of the wings is kind of cracked and there's a hole in the fuselage and the landing gear doesn't work, I'm like, I'm not getting on that plane, right?
No.
Right.
But this is what nutrition science really is. It's the analysis, it's essentially the same thing, but people are saying, well, that's the best we have, right? So I'm like, well, that ain't good enough, So I mean, if we're going to say we don't know, just be honest, say we don't know, and just focus on getting people healthy today, and I think we do a hell of a lot better.
Yeah, and I just always come back to people when they say about, my doctor said eating red meat's bad. My doctor says eating eggs is bad, or I can have 2 eggs a week, which, oh, how benevolent, right? I mean, it's comical. But my comment is, so how long have humans been eating mostly meat and eggs and dairy for the most part? I mean, for thousands of years, largely without any kind of problems. There are some cultures that probably didn't eat a lot of kind of dairy, possibly, but most any culture. In fact, I always challenge somebody, tell me a culture in history, from years and years and years ago that has survived on plants and fruit alone. There is not one.
Yeah, that's true. I mean, that's clearly true. This is a funny thing, if we look at like, because people say, well, chimpanzees and related to chimpanzees and they eat a lot of fruit. And I said, yeah, they still got small brains.
Right.
If that would have if access to fruit would have driven a larger brain, why didn't their brain develop? I mean, they've been eating the same stuff for arguably 10 million years or something like that. So, yeah, I mean, meat is, gosh, there's a wonderful paper Mickey Bendor, Rafi Sertoli, and Randon Barca wrote in 2021. It's called the Human Trophic Level Theory of Evolution or something along those lines. And it's just a great study. It looks at 25 different converging scientific ways to look at things. And it all points to a very heavily carnivorous sort of, bent to humanity for a long, long time. Now, clearly we eat an omnivorous diet today. I mean, there's people around the world that have been eating a mixed diet and none of them are dropping dead right away. So, I mean, it's clearly, we have the capacity to do that. But I mean, as far as what's optimal and best for one individual, I thought just find out for yourself. My gosh. I mean, don't let your doctor tell you, because most of the doctors don't know the hell they're talking about when it comes to nutrition. They're clueless.
Well, look at them. Seriously.
Well, I mean, yeah, a lot of them aren't particularly healthy, but they're not the expert. No. I mean, it's like going to a plumber to get advice on the car tires. I mean, you might as well just ask the guy on this. You might as well ask the plumber what to eat. I mean, when it comes to physicians, because they really don't know.
Well, I have to, let's take it even into the diabetic realm. I mean, what we tell our diabetics to do from a medical standpoint is put fuel on it and then go ahead and eat as much sugar as you can. But I think the pyramid with our food and the sad American diet is kind of one of the shifts too in our culture. We started processing all our food. So it wasn't just fruits and vegetables that were giving us our carbs. Now it's all this highly processed food that, it's just like adding fuel to a fire.
Yeah. Well, I mean, you remember the USDA, my plate, pyramid, whatever you want to do. Remember, the USDA's job is to sell commodities. I mean, it's not, right. I mean, they've got, they got wheat, corn, soy, sugar,
exactly.
Whatever. I mean, to be fair, beef, eggs, and dairy as well. But I mean, they just want to sell as many commodities as possible. So their recommendations don't really have to do with health. It's how can we sell all these commodities that we produce here in the US? And most of those, like you said, the wheat, the corn, the sugar, that all goes into this ultra processed, highly processed food. And I think, when you start processing food and turning it into powder, right? Powdered sugar, powdered flour, that dramatically changes the bioavailability, the absorption characteristics of that food. It's not how we're designed to eat it. If I were out in the woods, I would not find powder. It just doesn't exist. And it would take me a hell of a lot of work to turn it into powder. So that's not how we're supposed to do this. And so when we're eating cake or cookies, which are basically just powder that's been stuck back together, it just changes it so much that it like I said, and I know a lot of people are talking about these GLP-1s and these other incretin hormones, GIPs and glucagon medications, mimetics and things like that. Well, I mean, when you're eating this, kind of, I'll call it food products, it messes all those things up. If you eat the best and most natural Ozempic is probably a steak. I mean, because it causes GLP release in the body in a physiologically appropriate way, by the way. Those hormones are only supposed to be around for a period of minutes, in the human body. Whereas you take an injection, it sits in your system for weeks at a time. And it's like, to me, it's like the analogy of if I go out and exercise, go run some sprints, my heart rate's going to go up for a period of time, right? But if I were to sit on a couch and inject a drug, maybe dobutamine or something, I inject the drug to make my heart go up and it stays up for like 12 hours, that would be a problem, right? It's not the same physiologic response.
Right. Hey, that's a really good analogy. I like that analogy. Just because your heart rate goes up from a drug doesn't mean it was like exercise, for sure. So as we wind this podcast up, Dr. Baker, you've been on Joe Rogan a couple times. We've watched both episodes. In fact, that's how I first found out about you, was in 2015 when I saw you on Joe Rogan. And one of the ways to really get stories out and information out is be on Joe Rogan, one of the most watched platforms around. So from your last episode on Joe Rogan, which was a few months ago, I think last winter or last fall.
It was end of November. Yeah, just
November.
Just a couple months ago. Yeah.
If there was one segment out of there that you could take away that you could give us today, what would that be?
Oh my gosh.
That's action packed.
I know there's a lot.
Yeah, I mean, I thought, like I said, I think the realization of how, they are trying to position up. They're kind of, I don't want to use the word grooming, but they're kind of habituating us into accepting ultra processed food as healthy natural food. And I think, the NOVA classification system, which the USDA is trying to prove for whatever reason, I'm not sure, that you can consume a diet that is 91% ultra processed and still meet the healthy guidelines. I mean, to me, that's just absurd that we would be even considering that. And we see physicians out there that are like, well, these ultra processed foods are the reality, and we need to just accept it and suck it up and just shut up and take your drugs and eat your crap. I mean, it's more of the same stuff. So I think that's really eye-opening as to where we're going, because I can't think of anybody that would actually say this highly processed stuff that might have 27 ingredients, half of which I can't pronounce, are now supposed to be what I'm supposed to be eating. It doesn't make any sense. So I know there was a segment where Joe was reading from the study directly, and he was kind of blown away, as he should be, because it's just ridiculous.
I remember watching that part too and just going, oh my gosh, it is incredible to think that is what's going to make somebody healthy. Unbelievable. So as we wrap this podcast up, Dr. Baker, what do you have a passion for?
Oh, goodness. Well, I mean, obviously, career-wise, I'm very excited and motivated to sort of change the way healthcare is. I mean, I think obviously there's a lot of physicians that just go along and get along, they just accept their lot. And I think many of them are not happy, but I'm not, I'm not satisfied with just that. I'm hopefully we can actually change the way we address health in this system, and instead of the quote unquote sick care system that we have, that we actually start, it doesn't make sense to spend a bunch of money, being reactionary and trying to medicate everybody. And what I say is Band-Aid everybody. Let's start fixing people so they're no longer a disease. I mean, I think we have it possible to actually cure disease. I think most physicians have given up on curing. I mean, they literally don't. I mean, it's literally disease management. We don't talk about cures enough anymore. And I don't think we can talk about cures until we have causation. And, again, everything's idiopathic. Oh, we don't know. So here, but just take this pill and we'll see you in 6 months for your refill. So I'm passionate about changing the way we do business when it comes to healthcare. And hopefully we'll get that done, with Rivero and other companies like it. We're going to see I think we're going to see a significant number of people that are frustrated, like you guys are, like I am, like many, many patients are, that is going to change. I think we've reached a tipping point. I think the last few years have definitely put definitely highlighted that.
I agree with you 100%. I do see a tipping point. I do see a change. Julie, let's go ahead and stream Dr. Baker's website. Tell us about your website and what's the best way to get a hold of you if anybody has any questions.
Yeah, so that's carnivore.diet. That's one of the websites. So I hold regular meetings there with people that are doing a carnivore diet. I'm there every day, pretty much 7 days a week. Unless I'm on a plane, then I can't do it. But I've got several social media places. Rivero.com is a great place if you need a physician that's interested in taking you off medications and treating the root cause stuff. My social media, I'm on Instagram. I'm at Shawn, SHAWN, Baker, BAKER 1967. So my name like it's spelled, and then 1967. I'm on, X, which was formerly Twitter, at SBakerMD. And then I've got a YouTube channel. It's called Shawn Baker MD. So those are places where I frequent.
I love it. And I just got to tell everybody, you follow him on social media, because you not only will you learn a lot, you'll get to understand Dr. Baker's sense of humor, which he does have a sense of humor. And sometimes when you're fighting vegans, you have to have a sense of humor. So I appreciate you being on today, Dr. Baker.
Hey, thanks for having me. Let me speak to your folks. Appreciate it, guys.
Yeah. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Wednesday, 8 a.m. to 9 a.m. We're going to have Naomi Wolf on our podcast to be talking about medical freedom. You don't want to miss out on that. And tune in Wednesday, 8 to 9 a.m. Pacific Standard Time. Dr. Baker, thank you so much for tuning in today.
All right. Thanks, guys.